Okay guys, Timmy coming at you again. And today what I want to do is I want to explain to you the mechanism of action of Nsaids and corticosteroids. Now look, one of the things you have to remember, and they get their names, cortic, right? That should sound familiar. That should sound like cortisol, right? And we learned in the last unit that cortisol suppresses the immune system, right? And one of the functions of the immune system is to produce inflammation. So if you suppress the immune system, you won't get inflammation. That's how corticosteroids work as an anti-inflammatory. Now it's very basic, and I'll get into a little more detail about this. All right, Nsaids, as the name implies, non-steroidal anti-inflammatory drugs. All right, so what I'm going to do is I'm going to talk to you about those first, and then I'm going to explain to you the mechanism of action of the corticosteroids. All right, so here we go. First of all, these are the common Nsaids, right? You should know that. Now, one of the drugs that you won't see on the list is acetaminophen, right? Or Tylenol. Because Tylenol is not an anti-inflammatory. Tylenol works centrally in the brain. It doesn't affect what happens in the body in terms of the inflammatory process. More on that later. But these are the common ones, right? You got your Motrin, your Naproxen, right? Your Celebrex, your Indomethacin, Indocin, all that stuff. And high-dose aspirin can function as an anti-inflammatory too. All right, so watch. If you recall from watching the video on inflammation, prostaglandins, these chemicals, are intimately involved in producing inflammation. They're also intimately involved in producing fever, and they also stimulate pain receptors in the area of tissue damage or infection. So prostaglandins, when they're produced by white blood cells or other cells of the immune system, or they're released from your own cells. Let's say you twist your ankle and you damage your ankle cells. Those damaged cells will release those prostaglandins, and that will cause inflammation. Now, how do you get inflammation? Number one, the capillaries start getting leaky, so make sure you watch that video. And if they become leaky, then what happens? Watch it. Hang on. Right? If they become leaky, I'm gonna get this. Alright, so here's a little capillary. I'm gonna put some holes in it. And then you got a cell. Boom. Who cares what cell it is? What's gonna happen is, because there's now holes in the capillary, fluid from the capillary is going to go into the interstitial space, right? So, and that fluid is going to collect in the interstitial space and produce edema. So one of the signs of inflammation is, of course, swelling, edema. Now, the other thing is that it's going to cause arterial vasodilation, right? So you're going to get the arterial vasodilation. You remember that arteries carry blood that's oxygenated, and because arteries tend to stay closer to the core of the body, right? You don't have a lot of arteries that come to the surface of the skin. That blood is warmer, so that area will become red and warm. And again, they stimulate pain receptors. Here's the other thing too. Prostaglandins are involved in the blood clotting mechanism. So NSAIDs are also can be used as a anticoagulant. That's why if you're having surgery, like elective surgery, then you're informed that you should stop taking aspirin or NSAIDs about 7 days before you have surgery, because they don't want you taking a bunch of ibuprofen or aspirin and then bleeding out during surgery, and they can't control it. All right? So remember that NSAIDs, they work at the site of the tissue damage or infection, right? So they're anti-inflammatory drugs. And because prostaglandins are also involved in the formation of fever, they can be used as antipyretic drugs. And prostaglandins also stimulate pain receptors, so they can be used as analgesics, right? So they reduce inflammation, they reduce pain, they reduce fever, and they're an anticoagulant. And then real quick, my 2 cents worth on what about Tylenol? Tylenol, you produce prostaglandins in your brain. And where do you feel pain? In your brain. You should write that down. Look, I even got a smiley face there. So Tylenol inhibits the synthesis of prostaglandins centrally in the brain. So they can be used, Tylenol can be used as an analgesic to reduce pain, and it can be used as an antipyretic, right? It can reduce fever because the hypothalamus controls temperature, and if you can prevent the synthesis of prostaglandins in your brain, bam, you won't get a fever. But because they act centrally and inflammation, damage to parts of the body occur in the body and not in the brain, then Tylenol cannot be used as an anti-inflammatory, and it's very important. And because the mechanism of action is different. If you got a kid and they got a fever, right? You call the doctor, doctor, my baby's got a fever, what do I do? And they'll say, I don't know. That's what I'd say too. I don't know. Look it up. No, they're going to tell you to alternate ibuprofen and Tylenol. That way you reduce the risk of overdosing a kid on that one particular medication, because the mechanism of action is different. And by altering it, you can control that fever. And you don't give them Tylenol and ibuprofen all the time, right? You want that fever to go up. The body does stuff that makes sense. You just don't want that fever to stay up or get real high. That's why if you got a kid's got a fever of 101 or 102, okay, that's good. The body does stuff that makes sense. And from that video, I explained to you that the cells of the immune system that control infection work better at higher temperatures. So you don't want to constantly suppress that fever. That's why it's every 4 to 6 hours. See, there's reasons why they do stuff. All right. Okay. Now, again, quick and dirty. Hopefully that helps. Let's look at steroids for a minute. Right? Now watch. Arachidonic acid, which is a essential fatty acid, is required in order to make these chemicals of inflammation. And just so you know, prostaglandins are not the only chemicals that are involved in inflammation or producing fever. So if you look, NSAIDs just inhibit the synthesis of prostaglandins, where corticosteroids basically inhibit the whole process of inflammation. That is why steroids, corticosteroids that mimic cortisol, are much more powerful anti-inflammatory drugs. The problem with that is that, and this is very important, anytime you see a cascade of chemical reactions like here, the farther up you inhibit that process. Here you're inhibiting it right here, prostaglandins. Here with corticosteroids, you're inhibiting this. That means that you're inhibiting this process and this process. And as a result, you're going to get this profound anti-inflammatory effect, but you're also going to get the other side effects associated with the use of corticosteroids, because you're basically suppressing the entire inflammatory process. That's why corticosteroids are not used forever. It's bad for you. And they're usually given in a step-down dose, right? And I explained that too, right? So they step you down on corticosteroids to allow your own adrenal cortex to start naturally producing that cortisol again. Tell me you got that. So that's the primary difference between Nsaids and corticosteroids, and also a little tidbit on the effects of Tylenol. And I hoped that helped just a little bit.